Section 53 of Gray's Anatomy, Part 2. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recorded by Laurie Ann Walden. Anatomy of the Human Body, Part 2, by Henry Gray. The Muscles and Fascia of the Leg, Part 2. The Deep Group. Popliteus, Flexor digitorum longus, Flexor Hallucis longus, Tibialis posterior. Deep transverse fascia. The deep transverse fascia of the leg is a transversely placed intermuscular septum between the superficial and deep muscles of the back of the leg. At the sides it is connected to the margins of the tibia and fibula. Above, where it covers the popliteus, it is thick and dense, and receives an expansion from the tendon of the semimembranosus. It is thinner in the middle of the leg, but below, where it covers the tendons passing behind the malleoli, it is thickened and continuous with the laciniate ligament. The popliteus is a thin, flat, triangular muscle, which forms the lower part of the floor of the popliteal fossa. It arises by a strong tendon about 2.5 centimeters long, from a depression at the anterior part of the groove on the lateral condyle of the femur, and to a small extent from the oblique popliteal ligament of the knee joint, and is inserted into the medial 2/3 of the triangular surface above the popliteal line on the posterior surface of the body of the tibia, and into the tendinous expansion covering the surface of the muscle. Variations. Additional head from the sesamoid bone in the outer head of the gastrocnemius. Popliteus minor, rare, origin from femur on the inner side of the plantaris, insertion into the posterior ligament of the knee joint. Peroneotibialis, 14%, origin inner side of the head of the fibula, insertion into the upper end of the oblique line of the tibia. It lies beneath the popliteus. The Flexor Hallucis longus is situated on the fibular side of the leg. It arises from the inferior 2/3 of the posterior surface of the body of the fibula, with the exception of 2.5 centimeters at its lowest part, from the lower part of the interosseous membrane, from an intermuscular septum between it and the peronei laterally, and from the fascia covering the tibialis posterior medially. The fibers pass obliquely downward and backward, and end in a tendon which occupies nearly the whole length of the posterior surface of the muscle. This tendon lies in a groove which crosses the posterior surface of the lower end of the tibia, the posterior surface of the talus, and the under surface of the sustentaculum tali of the calcaneus. In the sole of the foot it runs forward between the two heads of the Flexor Hallucis brevis, and is inserted into the base of the last phalanx of the great toe. The grooves on the talus and calcaneus, which contain the tendon of the muscle, are converted by tendinous fibers into distinct canals, lined by a mucous sheath. As the tendon passes forward in the sole of the foot, it is situated above, and crosses from the lateral to the medial side of the tendon of the Flexor digitorum longus, to which it is connected by a fibrous slip. Variations. Usually a slip runs to the Flexor digitorum, and frequently an additional slip runs from the Flexor digitorum to the Flexor hallucis. Peroneocalcaneus internus, rare, origin below or outside the Flexor hallucis from the back of the fibula, passes over the sustentaculum tali with the Flexor hallucis, and is inserted into the calcaneum. The Flexor digitorum longus is situated on the tibial side of the leg. At its origin it is thin and pointed, but it gradually increases in size as it descends. It arises from the posterior surface of the body of the tibia, from immediately below the popliteal line to within 7 or 8 centimeters of its lower extremity, medial to the tibial origin of the tibialis posterior. It also arises from the fascia covering the tibialis posterior. The fibers end in a tendon, which runs nearly the whole length of the posterior surface of the muscle. This tendon passes behind the medial malleolus in a groove common to it and the tibialis posterior, but separated from the latter by a fibrous septum, each tendon being contained in a special compartment lined by a separate mucous sheath. It passes obliquely forward and lateralward, superficial to the deltoid ligament of the ankle joint, into the sole of the foot, where it crosses below the tendon of the Flexor Hallucis longus, and receives from it a strong tendinous slip. It then expands and is joined by the quadratus plantae, and finally divides into 4 tendons which are inserted into the bases of the last phalanges of the 2nd, 3rd, 4th, and 5th toes, each tendon passing through an opening in the corresponding tendon of the flexor digitorum brevis, opposite the base of the first phalanx. Variations: Flexor accessorius longus digitorum, not infrequent, origin from fibula or tibia or the deep fascia, and ending in a tendon which, after passing beneath the laciniate ligament, joins the tendon of the long flexor or the quadratus plantae. The tibialis posterior, tibialis posticus, lies between the 2 preceding muscles and is the most deeply seated of the muscles on the back of the leg. It begins above by 2 pointed processes, separated by an angular interval, through which the anterior tibial vessels pass forward to the front of the leg. It arises from the whole of the posterior surface of the interosseous membrane, excepting its lowest part, from the lateral portion of the posterior surface of the body of the tibia, between the commencement of the popliteal line above and the junction of the middle and lower thirds of the body below, and from the upper 2/3 of the medial surface of the fibula. Some fibers also arise from the deep transverse fascia, and from the intermuscular septa separating it from the adjacent muscles. In the lower 4th of the leg its tendon passes in front of that of the flexor digitorum longus, and lies with it in a groove behind the medial malleolus, but enclosed in a separate sheath. It next passes under the laciniate and over the deltoid ligament into the foot, and then beneath the plantar calcaneo-navicular ligament. The tendon contains a sesamoid fibrocartilage, as it runs under the plantar calcaneo-navicular ligament. It is inserted into the tuberosity of the navicular bone, and gives off fibrous expansions, one of which passes backward to the sustentaculum tali of the calcaneus, others forward and lateralward to the 3 cuneiforms, the cuboid, and the bases of the 2nd, 3rd, and 4th metatarsal bones. Nerves. The popliteus is supplied by the 4th and 5th lumbar and 1st sacral nerves, the flexor digitorum longus and tibialis posterior by the 5th lumbar and 1st sacral, and the flexor hallucis longus by the 5th lumbar and the 1st and 2nd sacral nerves through the tibial nerve. Actions. The popliteus assists in flexing the leg upon the thigh. When the leg is flexed, it will rotate the tibia inward. It is especially called into action at the beginning of the act of bending the knee, inasmuch as it produces the slight inward rotation of the tibia, which is essential in the early stage of this movement. The tibialis posterior is a direct extensor of the foot at the ankle joint. Acting in conjunction with the tibialis anterior, it turns the sole of the foot upward and medialward, i.e., inverts the foot, antagonizing the peronei, which turn it upward and lateralward, or evert it. In the sole of the foot, the tendon of the tibialis posterior lies directly below the plantar calcaneo-navicular ligament, and is therefore an important factor in maintaining the arch of the foot. The flexor digitorum longus and flexor hallucis longus are the direct flexors of the phalanges, and, continuing their action, extend the foot upon the leg. They assist the gastrocnemius and soleus in extending the foot, as in the act of walking, or in standing on tiptoe. In consequence of the oblique direction of its tendons, the flexor digitorum longus would draw the toes medialward, were it not for the quadratus plantae, which is inserted into the lateral side of the tendon, and draws it to the middle line of the foot. Taking their fixed point from the foot, these muscles serve to maintain the upright posture by steadying the tibia and fibula perpendicularly upon the talus. 3. The lateral crural muscles, Peroneus longus, Peroneus brevis. The Peroneus Longus is situated at the upper part of the lateral side of the leg, and is the more superficial of the two muscles. It arises from the head and upper 2/3 of the lateral surface of the body of the fibula, from the deep surface of the fascia, and from the intermuscular septa between it and the muscles on the front and back of the leg, occasionally also by a few fibers from the lateral condyle of the tibia. Between its attachments to the head and to the body of the fibula there is a gap through which the common peroneal nerve passes to the front of the leg. It ends in a long tendon, which runs behind the lateral malleolus in a groove common to it and the tendon of the peroneus brevis, behind which it lies. The groove is converted into a canal by the superior peroneal retinaculum, and the tendons in it are contained in a common mucous sheath. The tendon then extends obliquely forward across the lateral side of the calcaneus, below the trochlear process, and the tendon of the peroneus brevis, and under cover of the inferior peroneal retinaculum. It crosses the lateral side of the cuboid, and then runs on the under surface of that bone, in a groove which is converted into a canal by the long plantar ligament. The tendon then crosses the sole of the foot obliquely, and is inserted into the lateral side of the base of the first metatarsal bone, and the lateral side of the first cuneiform. Occasionally it sends a slip to the base of the second metatarsal bone. The tendon changes its direction at 2 points: first, behind the lateral malleolus; secondly, on the cuboid bone. In both of these situations the tendon is thickened, and in the latter a sesamoid fibrocartilage, sometimes a bone, is usually developed in its substance. The peroneus brevis lies under cover of the peroneus longus, and is a shorter and smaller muscle. It arises from the lower 2/3 of the lateral surface of the body of the fibula, medial to the peroneus longus, and from the intermuscular septa separating it from the adjacent muscles on the front and back of the leg. The fibers pass vertically downward and end in a tendon which runs behind the lateral malleolus, along with, but in front of, that of the preceding muscle, the two tendons being enclosed in the same compartment, and lubricated by a common mucous sheath. It then runs forward on the lateral side of the calcaneus, above the trochlear process and the tendon of the peroneus longus, and is inserted into the tuberosity at the base of the fifth metatarsal bone on its lateral side. On the lateral surface of the calcaneus, the tendons of the peronei longus and brevis occupy separate osseo-aponeurotic canals formed by the calcaneus and the peroneal retinacula. Each tendon is enveloped by a forward prolongation of the common mucous sheath. Variations. Fusion of the two peronei is rare. A slip from the peroneus longus to the base of the third, fourth, or fifth metatarsal bone, or to the adductor hallucis, is occasionally seen. Peroneus accessorius, origin from the fibula between the longus and brevis, joins the tendon of the longus in the sole of the foot. Peroneus quinti digiti, rare, origin lower fourth of the fibula, under the brevis, insertion into the extensor aponeurosis of the little toe. More common as a slip of the tendon of the peroneus brevis. Peroneus quartus, 13%, Gruber, origin back of fibula between the brevis and the flexor hallucis, insertion into the peroneal spine of the calcaneum, peroneocalcaneus externum, or, less frequently, into the tuberosity of the cuboid, peroneocuboideus. Nerves. The peronei longus and brevis are supplied by the fourth and fifth lumbar and first sacral nerves through the superficial peroneal nerve. Actions. The peronei longus and brevis extend the foot upon the leg, in conjunction with the tibialis posterior, antagonizing the tibialis anterior and peroneus tertius, which are flexors of the foot. The peroneus longus also everts the sole of the foot, and from the oblique direction of the tendon across the sole of the foot is an important agent in the maintenance of the transverse arch. Taking their fixed points below, the peronei serve to steady the leg upon the foot. This is especially the case in standing upon one leg, when the tendency of the superincumbent weight is to throw the leg medialward. The Peroneus Longus overcomes this tendency by drawing on the lateral side of the leg. End of section 53.